Well, hey there, and welcome to this week's edition of Your Weekly Dose. I'm Laura Wilkerson. I'm a nurse practitioner, and I help families just like yours navigate the difficulties of dementia care. So, this week I want to talk to you about hydration. It has been an abnormally hot summer so far, and we're not even really into summer. So, what does that look like for you when you're dealing with your person who doesn't want to drink the right amount of fluids? Excuse me. Myself, I used to formerly be a caffeine addict. I would drink coffee all day long. I now have a hydro jug. I don't recommend this for any of your loved ones, but I now have a hydro jug. My job is to drink two of these a day. And I'm doing a really poor job, by the way, today, because I was busy thinking about the connection between urinary tract infections and hydration status and the need to discuss it. So last week I was covering for one of our nurse practitioners here in the practice, and I was looking at the numbers of labs that came back for urine specimens and thinking about when the person called why they were requesting a urine specimen be drawn. And most of the time it was due to behaviors, because we are trained to think that anytime something goes wrong with our person with dementia, we immediately think, oh my gosh, they have a urinary tract infection. Well, and this may or may not be true. Some of the urines that came back were positive because there was indeed bacteria in the urine. And the other urines that came back that were negative, there was other causes. So I started to investigate this and think to myself, I wonder what's causing this. So I started to look, and I saw that a lot of these people were actually dehydrated. And then I started to do a little bit more investigation. And the Journal of Gerontological Nursing said that like 48% of elderly adults that are admitted to the ER are found to have dehydration when they're sent for confusion or delirium. And 31% of long-term care residents are actually also underhydrated and found to be dehydrated with lab work. So you're probably kind of wondering, why do I have a picture of 4 cups in the background? Well, the reason I have these 4 cups is because if we can get to the true cause of why every time that we think that our person is becoming more confused or that they're delusional or they're having more falls, if we actually treated the root cause, which might be dehydration in your person, not necessarily a urinary tract infection, and we can get more fluids in them, we might solve the problem. So, what are some reasons that you can think of off the top of your head that your person might not want to intake more fluids? Or why are you having difficulty getting your person fluids? Or if you are a care worker in an assisted living or a memory care unit, what are some of the reasons why you're having problems getting fluids into your people? Well, I've been doing this for, I'm not going to admit how many years, but I've been doing this for a really long time. And quite honestly, I have heard every reason practically from every patient that I can think of. And one of the biggest is that women don't want to be a burden. Men don't want to be a burden. They don't want to have to keep asking for hydration. So if they have mobility problems, or if they're dependent on you as a caregiver, professional or paid, paid or not paid caregiver, they don't want to depend on you to have to keep getting them fluids. So they don't want to be a bother. They're not going to ask. The second reason is they might have limited mobility, so it's difficult for them to get up out of their chair or their wheelchair when they need to use the restroom. And again, they feel like they're bothering you. So they're not going to intake a ton of fluids because then they're going to have to get up and use the restroom. The third reason, obviously, might be once you are drinking monumental amounts of fluid, then you're going to have to go to the bathroom more. So if you are already incontinent, most people don't want to sit in a soiled undergarment. Some people are afraid of the odor that it will cause when they are maybe at an event and they've lost sensation in their lower extremities and they're incontinent. And obviously we know the longer that you sit in an soiled undergarment, the more it's going to smell. So a lot of ladies and gentlemen fear that if they get out in public, they're playing cards or they're at an event or they're outside doing something, that there's going to be an odor to this. But one of the simplest things that I've found is that we serve people in different types of cups. Again, I have a huge jug here that I drink out of all day long. But if you're putting, like the cups that I have in the background of this picture, if you're putting cups like this in front of a person, again, whether you're a paid caregiver or an unpaid caregiver, if your person with dementia or even your person not with dementia has any sort of limitation in their eyesight, we are making it a little bit difficult for them. So I have here what it might look like to your person if they have macular degeneration or glaucoma. So you can see a little bit of the outline here of the gray cup that I have, but here pretty much the blue cup is completely gone out of the picture. And this is maybe mild to moderate visual impairment. Here you can see the red cup the best, and you can sort of see this clear cup. But now if I want my person to drink more fluids and I've put water inside of this cup, you can't tell if there's any water inside the cup or not. I know you can't see it in the red cup either, but you can definitely, that red cup still stands out. Here again, I've made it just a little bit worse. And now the clear cup is almost gone and looks like a ray of sunshine kind of coming in across the cups. The gray cup you can still see. The red cup stands out still more so than the other cups, but it still has a little bit of obscured edges here. The blue cup is almost completely gone. So if you're setting your person up with cups and you are expecting them to drink more fluids, then you're going to have to offer them fluids in something that they can see. And as you can see, with the worst lens over my iPhone, the red cup stands out the most. Let's go back to this other one if we can. I don't know if I'm going to be able to get that to go backward. Yeah, so you can see here, the red cup stands out the most. There's still some blurring and there's still some disturbance to the eyesight, but the red cup is what stands out the most. The other thing that you can do for your loved one is, if you are a caregiver who comes and brings your person groceries or you bring them items. I know last week I was seeing somebody and I asked her before I left if there was anything that I could do. Would she like some water because she wasn't set up? There was nothing at her side table. And she said, sure. And I went to the refrigerator and I grabbed her water that was in the container and I took it to her. And then I thought, I should probably turn back around. And I looked, and sure enough, she was struggling with that lid. I don't know about you, but I do have a little bit of arthritis in my fingers. And I can tell you, those lids on like Aquafina or any of the other brands, they're hard to get off. So I even had to use like a gripper and open her bottle for her. But if you're setting your loved one up that way, putting the fluids inside of their fridge, maybe take a few of them if you're there weekly and just loosen up the cap so that they can have easier accessibility to the water that you've provided for them. So I want to talk about dehydration versus a urinary tract infection, and how each one might present. So with dehydration, you're going to have dry mucous membranes. The eyelids are going to be dry. The inside of the mouth is going to be dry. Your person might be complaining of constipation, and dehydration can lead to a urinary tract infection, and it can also lead to renal failure or acute kidney injury. Where on the other side, if your person has a UTI, they might complain of some flank pain, their urine's going to be darker, they might have less urine, but both of them, dehydration and a UTI, can act very similar. Your person's going to be confused, they're going to have delirium, they're going to have falls and muscle weakness, they're going to have low blood pressure, they're going to have an increased heart rate, they may or may not be sleepy, they're going to have decreased urine output. So how many of you have called your doctor's office and said, my person's confused, they are a little bit delirious, their behavior has changed, they've got muscle weakness, you know what, they've fallen a couple of times, this isn't like them, I suspect that they have a urinary tract infection. Well, as you can see, dehydration and urinary tract infections overlap one another. So if instead of every time waiting for that urinary tract infection to come because you're not treating the root cause, well, I think the solution might be offering your person fluids and trying to get more in them. Again, offering them a cup that they can see. There are tons of fruits and vegetables that have higher consistencies of water. We're coming into summer. Watermelon is a great source of water to push more fluid in your person. Popsicles, again, you can offer those to your person. Asking your person what their preferred fluid is, and then offering them that. Now, I know that there's been a lot of controversy over giving your person coffee or tea because both of them can irritate the bladder. But actually, I was just reading in the British Journal of Medicine that people who were caffeine addicted or are caffeine addicted actually don't have the same kind of bladder irritation and problems that somebody who is not consuming as much caffeine would have. So if your person's preference is coffee or tea, you can offer them that. Talk to your person. If your person is capable of talking to you about increasing their fluids, well, then talk to them and let them know, look, if we can get more fluids in you, that might mean we're not giving you an antibiotic. We're not going to have to send you to the ER or to an urgent care on a Saturday when you're watching your favorite show or visiting with your family. So if we can talk to our person reasonably, asking them how they feel about increasing their fluids. And again, don't overwhelm them. Don't give them a jug like this and set it in front of them and say, okay, you've got, 2,300 milliliters of fluid that you have to drink by the end of the day. And of course, I want you to always consult with your primary care, your nurse practitioner, your physician, because I know that some of you are going to say, well, my person has other chronic conditions. They have congestive heart failure. They have kidney disease. Yes, your person is going to have fluid restrictions as opposed to somebody who is healthier. So what are the causes between dehydration and a urinary tract infection? Well, obviously, like I said, older age-related changes. As we get older, our sense of thirst blunts. So if your person is not able to be reasoned with, like you can't tell them this is why we need to drink more fluids, don't expect that your person is going to automatically just want to drink because you put it in front of them. As we age, we don't have that urge to drink as much as we used to when we were exerting more energy and causing ourselves to sweat or lose fluids. And again, they're not making as much urine output either, so they're not going to have that cycle of thirst and urination. Oftentimes, medications can cause us to become dehydrated. And what that looks like is, anybody that takes a diuretic, obviously, they are going to be urinating more. So we're going to want to put fluids in. Again, I understand that there are some chronic conditions where we don't want to do that. So please consult your primary care. Being functionally dependent. If your person can't get up to get their own fluids, well, then that means that they're dependent on somebody else. And if your person is living in an assisted living or a memory care unit, they might not be staffed adequately. They might have some issues with staffing. So making sure that we leave in their room and close to where they can get it if they're wheelchair dependent, where they can actually get their own fluids. Cognitive impairment, their mind's not telling them to drink, their brain's not telling them to drink. And then lastly, comorbidities. Diabetes, hypertension, kidney failure, or kidney disease. Some forms of cancer can also cause dehydration. As opposed to the other side, for urinary tract infections, what are those causes? Incontinence, sitting in a dirty or soiled undergarments, incomplete bladder emptying. If they have a functional problem where their bladder doesn't empty completely, that residual urine that's left inside of the bladder, that can brew bacteria, and that bacteria takes over, and then they get signs and symptoms of a urinary tract infection. Dehydration. Dehydration can cause urinary tract infections. Contamination of stool into the urethra of a woman or a man can cause urinary tract infections. Structural dysfunction. So sometimes as we age, we have changes down there. We might have had a hysterectomy, or we might have had issues with our prostate where they had to go in and do some repairs or cleaning out of the prostate. And when they've done that, they've caused strictures or adhesions, and those structural dysfunctions can cause decreased flow of urine, and that therefore can lead to a UTI. Mobility issues, simply just not getting up and using the restroom. So again, hydration is really super important. The symptoms of dehydration and urinary tract infection can overlap. So treating the root cause, which could be hydration, which is leading to urinary tract infections in your older adult. Look at how much your person is drinking. Try and keep a log of that to see what their baseline is. What are they drinking? Then talk to their primary care office. You can call their nurse, or you can ask the doctor for, an explanation of labs. How does my loved one look? Are their labs good or are their labs bad? And where can I make this better by increasing their hydration? And what would you recommend? How much would you recommend? Including your person on this decision. If they are capable, you will always get more buy-in from somebody if you explain it to them and you have their attention and best interest. So making sure that they're on board with your plan. Okay, mom, we are going to try to drink 4 bottles in the morning, 4 bottles in the afternoon, and 4 bottles in the evening. I can pretty much guarantee you, though, they're not going to want that night water. So try to figure out how to get your person to drink more water before it gets close to bedtime. Because if they have mobility issues, they're not going to want to be in a wet bed. If you're co-sleeping, you're not, and a spouse caring for somebody, you're not going to want to be in a wet bed either, and changing those sheets on a daily basis might be an issue. If you have any tips or tricks on how you've got your loved one to increase their fluid intake, I would love if you drop them below, because the more that we can share, the more we can learn together. If you haven't liked and subscribed to this YouTube channel, please do so and share this out with anybody who needs it. We will see you next week for the next edition of Your Weekly Dose. I hope you have a great week. Take care.